Welcome to the Think Factory podcast. We got one question for you. What keeps you up at night?
Welcome to the Think Factory's Workplace podcast, powered by OGC Solutions. My name is Alka Bahal. I am a partner with Outside General Counsel Solutions and the chair of our Corporate Immigration Services Group. I'll be your host today. I'm very pleased to have here with me Amit Shah, Chief Operations Officer at Virta Health. Welcome to the podcast, Amit.
Thank you so much, Alka. I'm really excited to be here today and grateful to be on the Think Factory podcast.
Well, it's our absolute pleasure. Can you start by telling our listeners a little bit about Virta and your current role?
Absolutely. Here at Virta, we're on a mission to reverse diabetes and obesity in 1 billion people. We have defined this term reversal, and where it comes from is we just have a fundamentally different approach to the world's health crises that exist today. Our belief is that the root cause of the problem that's driving a lot of the health issues that we have in the world today comes from poor nutrition. Poor nutrition drives the damaged metabolism. So what we eat is the problem, and that creates a damaged metabolism. And then that manifests itself in a bunch of different ways. Primarily, the big ones that we see are obesity, type 2 diabetes, prediabetes, and therefore our mission is to reverse those conditions in 1 billion people. And then beyond that, there's actually a host of other things that poor nutrition and damaged metabolism creates. Virta is the first company that has defined reversal, and we believe that that is the way to solve this health epidemic by helping people make the right decision on what they should eat, making a personalized decision that allows them to improve their health and do so sustainably. So we deliver through a continuous remote care model, through a telemedicine model. We deliver care to people and help them make the best healthcare decisions for themselves that allows them to improve their metabolic health.
Very interesting. Some bold challenges you've undertaken there. Let's dig into that a little bit. How do you define success in this journey, and what has been your biggest breakthrough so far?
Yeah, success is, oftentimes the journey itself is success for us. We do have this mission, and the mission is reversing diabetes and obesity in 1 billion people. So success would be both making progress and achieving that. That's obviously a lofty mission, so there are waypoints along the way. For us, the magic is when we are working with a patient and that patient understands how the decisions they're making, literally the food decisions, which is a decision people make multiple times a day, what to eat, impacts their metabolic health. And we can help them understand what decisions will be positive for their metabolic health. And they really start to change the way they eat. And so at the micro level, that is one version of success. That's one version of a waypoint of success. When we're able to do that across a population, what we generally see is significant improvement in weight reduction. So average weight loss at 1 year is close to 10% of body weight. We see a significant improvement in terms of blood sugar control if it's a type 2 diabetes population. And so we're looking for a hemoglobin A1C drop. Hemoglobin A1C is a measure of blood sugar in a common measure of blood sugar control. And then the third one, which is really unique to us, is we're looking for people to not be reliant on pharmaceuticals, on drugs, in order to manage the symptoms of their condition. So we reduce or eliminate key drugs like insulins, GLP-1s. They go by the GLP-1s, by the way, go by the trade name of Ozempic, Mounjaro, Zepbound, Wegovy. So very popular drugs these days. We get people off of those drugs while they're improving their metabolic health and sustain them off those drugs. Those are some of the key things that we're looking for as waypoints on this journey. And for us, we believe we're successful when we are able to do this at large scale. So today, hundreds of thousands of people across the entire United States are experiencing Virta and have been able to improve their health in this way. And we are just trying to grow that number as rapidly as possible.
Really impressive. That's quite an achievement. Looking at the U.S. healthcare system, I see this could be pretty challenging. What do you see as the most critical barriers to reversing these chronic diseases in the current system, and how is Virta working to dismantle them?
Alka, that's a great question. I think that we always say the biggest barrier is actually status quo. Um, I would lump status quo as two things that are kind of headwinds for us. Number one is the underlying approach, and I've already mentioned this a little bit when I talked about how Virta is different. But the underlying approach in our United States healthcare system is one where we are incentivized around activity and candidly around sickness. I won't be the first person to say that unfortunately we've built a little bit of a sick care system, and so our approach is generally to let people get sicker and sicker, and then to treat those symptoms, that sickness, with medication, candidly. And so Virta's approach is different. We solve the root cause of the problem. We have now over 20 peer-reviewed published papers that show that our root cause approach actually solves a variety of issues. Again, type 2 diabetes, prediabetes, obesity, but also it improves kidney function, liver function, it reduces inflammation, et cetera, et cetera. And so when you solve the root cause of the problem, you actually can create a healthcare system. People get healthier, and as they get healthier, they utilize the system more. And so the first key headwind is that the economic model that we've created, and the science that supports that economic model, is really around a sick care system, not a healthcare system. And I think that's a big headwind for us. And then related, but slightly different, is that influences the way we deliver care. The way we deliver care is time-based. Physicians or providers are spending time with individuals. It's episodic. It incentivizes this episodic approach. And the second thing that we do really differently is we provide longitudinal care. We provide it in your pocket. We deliver all of our care via app, and we are helping people understand how their body works, which allows us to personalize. Versus an episodic care, you're bound by all what you can educate a patient on in the moment or in the 5 minutes or 10 minutes that you have with them. And so, the biggest headwind we see is actually status quo. And the way we're dismantling it is we're showing people what works. We've got we've got peer-reviewed published papers to show that the science works, and that this approach of solving the root cause is rooted in real science and has worked for a long time. And then the second thing we're doing is we're actually doing it. We've served hundreds of thousands of people across all 50 states. We partner with self-insured employer groups and health plans, and we deliver them real results with a real ROI, with real change.
Amazing. How does your model of continuous remote care differ from traditional telemedicine or virtual care in a primary care setting?
Great question. Our model of continuous remote care is different. I would really say it's a further iteration on traditional telemed. So if you think about telemed version 1.0, that was taking what was happening in clinics and doing it not in clinics, basically. And so synchronous phone calls, synchronous video visits, et cetera. Telemed 2.0 involved some level of data tracking. And so, someone would get labs. The labs would then be reviewed on a phone call and whatnot. But it is still somewhat episodic. Continuous remote care takes that really to the next level, and we are longitudinal care. The things that we do differently are, we give people tools to track their biomarkers. And so there's an objective feedback loop. On a daily basis, members are able to track their glucose, ketones, weight, blood pressure, if applicable. And so we, not only is the member getting data on how their food decisions and how their lifestyle decisions are impacting their body near real time, our clinicians are getting that data. And because our clinicians are getting that data, they're able to intervene very rapidly. Again, I talked about people making a couple of healthcare decisions a day, somewhere between 1 and 5, depending on the number of times you eat, plus or minus. Of course, everyone's a little bit different. And we are able to intervene in those decisions and help you make a highly personalized decision based on your biomarker feedback loop. We're also able to, our clinicians, our doctors are able to prescribe and deprescribe medications, primarily deprescribe actually, based on the actual objective data that you have. So this continuous remote care system enables longitudinal care and lifestyle change, which is therefore more sustainable and has higher impact over time.
So you mentioned earlier, so talking about deprescribing medications, you talked about Virta as a GLP-1 off-ramp. Can you unpack that concept, especially for listeners unfamiliar with the current pharmacological trends with diabetes care? I mean, we've all seen, the videos for all the commercials and everything for all the GLP-1s, and it seems to be the latest and greatest medical trend.
Yeah. I'll start by just providing a little bit of context, which is that GLP-1s, glucagon-like peptides, that's that's what GLP-1 stands for, they are medication. That's a pharmacological solution or a medication that has been in the market for actually more than 20 years. I believe the first FDA-approved GLP-1s in the US were around 2005, and they were approved for type 2 diabetes. And the reason I share that is because they have become very popular in the last few years. But the actual molecule is not new. It's just that it's been applied to a new condition, which is obesity. And so since these drugs have been around since 2005, and Virta has been around since about 2015, we have just about a decade of experience on these drugs. As I shared earlier, we treat patients with obesity, prediabetes, type 2 diabetes. And since we've been treating patients with type 2 diabetes for, again, over about a decade, we have experience working with these drugs. And we, as far as I know, have the only peer-reviewed published paper that shows that we can get people off of their GLP-1 and maintain weight loss out to a year later. And this goes back to, and so to your question on off-ramp, the way we even have that data is that, again, we've been working with these drugs for over a decade, and we know how to get people to do lifestyle change. Now, in the last few years, these drugs have been clinically indicated, again, for a new condition, which is obesity. And because obesity impacts such a larger percentage of the population than type 2 diabetes, I think that's why they've been into the zeitgeist more. And again, just to name them, GLP-1s are Ozempic, Mounjaro, Zepbound, Wegovy. Those are the most popular trade names. And so when you see the commercials and the discussions around those drugs, that those are the drugs we're talking about here. But it turns out, to go back to why Virta is different, the underlying problem, the root cause of obesity and type 2 diabetes is the same. It's a damaged metabolism that's driven by poor nutritional choices or bad food choices. And so we help change that underlying root cause. And when you change that underlying root cause, you can fix the problem, and you can do so with the drug. Again, if someone's on a GLP-1, the FDA has said that these drugs should be done with lifestyle change. We can provide that lifestyle change. And when you do that, you can pull someone off the drug. That's the off-ramp. To be very honest, they don't need to get on the drug in the first place. We see about the same weight loss between 12 and 14% body weight loss in our clinical trial population, which is about the same as people saw on GLP-1s, and that's without the drug. And so if you make the right lifestyle changes, you can see the same results. Some patients feel like they need the drug to do a little bit of a kickstart on the weight loss, so we help them do that, but then we help them get off the drug too. At the end of the day, the lifestyle change is what makes it sustainable. There's now more than enough data out there that says people cycle on and off these drugs, and every time they come off these drugs, they generally gain the weight back. And so it's really important that we have Virta, a solution like Virta or Virta itself, to make the sustainable lifestyle change so that people are not cycling on the drugs, and so that we can avoid getting everyone on them.
Yeah, that makes sense. I can see how while you're on the medication, that's sort of helping control the weight loss, but once the medication's gone, the weight loss solution is gone. But with Virta, you theoretically have a permanent lifestyle change, which should then help keep the weight off in the long term.
That's right.
Very, very interesting. Let's turn to you now. You've helped scale multiple high growth healthcare organizations. Are there any operational playbooks or principles that have consistently worked for you?
I think there are two things that have really worked, or two things that I really focus on. Maybe before I get to them, I'll say these are kind of cultural approaches to how we build the business. And they make the core assumption that we are, as the CEO of Virta, Sami likes to say, cutting trees in the right forest. And what I mean by that is that we have the right strategy, we have an economic model that works, and are focused on scaling that. When you're in that position, I'm happy to talk about getting the right strategy and getting an economic model that works. But those to me are facets of a good business plan, or facets of a good approach. Assuming you have the approach right, the two things that I like to focus on, or that I think are key, are number one, first and foremost, is a very clear and prioritized focus on, in our case, the patient, or you can say the end user or the customer, but for Virta, that is the patient, and understanding what an incredible patient experience and outcome looks like. The more we focus on that, honestly, the better our business is. At the end of the day, again, our mission is to reverse diabetes and obesity for 1 billion people. So being excellent at the patient experience is integral for us. And so the number one thing that I like to do is create systems and processes so that we can focus on the patient experience, and in so doing, build our business really effectively. And then the second operational principle I have is to build systems and processes, not surprisingly, to make ourselves 1% better every day. We focus on constant and iterative improvement as a team, more than any one specific outcome. The way I like to think about it is that we can have, very lofty goals, and sometimes you can pull a rabbit out of the hat and achieve the goal. And you know what? Sometimes that's even necessary. But if we want to create a sustainably great business and a sustainably great company, what we really want to do is have systems and processes that make us better over and over and over again. Great feedback loops that make us better. By the way, this is no different than our continuous remote care model, where we're helping our patients look at biomarker feedback loops and improve there. And so it is a core mantra for us at Virta to drive this continuous improvement. When you pair those two things together, number one, focus on the customer experience or the patient experience for us. And number two, have systems or processes that make you better every single day. What you end up getting is this flywheel where, again, if you're cutting trees in the right forest and have the right economic model, then you're creating this flywheel where it gets harder and harder for anyone else to catch up with you.
I love that. Getting 1% better every day. That's terrific. So as a CEO, how do you balance driving financial performance while staying true to your mission-driven healthcare model? There has to be an economic incentive in there as well. Otherwise, it's hard to survive.
Absolutely. I didn't mention this or failed to mention it as we were talking about the key barriers to our success. And so I will mention it here, where this is one of the hard parts about healthcare in America. Our core economic model, again, is one of activity. and generally fee for service. And this is where Virta is really different. We're a value-based care provider, and so we put our fees at risk for the outcomes that we deliver. And so what that means is that our incentives are really aligned. The payer wants to see the outcomes that we talked about, so the clinical outcomes that that I've shared around weight loss and medication reduction and an A1C reduction and an ROI. The patient wants to see that, right? Patients that come to us want to get healthier. They want to see weight loss and medication reduction and A1C improvement and all that. And we want to see that. And so one of the really unique parts about our business model is that if we deliver for the N=1 patient, help them make the best decisions, nutritional decisions that improves their health, and then do that over time so it improves their health sustainably, then we are both delivering for that patient. When we do that for a bunch of patients together, a population, then we're delivering for our client. And it fuels our economic model where, because we put fees at risk, we can keep our fees. And so it's a good revenue model. This goes back to cutting trees in the right forest and having the right economic model. It has taken a long time, right? It's a very different way to deliver healthcare in America. But now we're doing it again for hundreds of thousands of people across the country with hundreds of different clients. And so that is how we're able to align both our economic or financial performance with our clinical performance. I will say, just to state it, unfortunately, that's very distinctive and unique in healthcare. It's rare that there's true alignment between what the patient needs, what the payer is looking for, and then what the provider is able to deliver. So
so true. So an interesting value-based model. You mentioned this is now providing support to patients all across America. Now, you've led operations across clinics, regions on an international level in multiple countries, and now a national digital health company. Is there a difference between leading in a different geographic region or the different modalities, since this is now fully digital?
Yes, I mean, there are definitely differences across geographies and modalities. I would say at Virta, from day one, we've been a digital first company. We've always delivered our care digitally. Mm-hmm. And we've more or less always been national. We kind of had patients across all 50 states pretty early in our tenure as a company. And so we, having grown up that way, the way we think about some of those differences are more I don't think about them as much in terms of how I lead is different. We think a lot about, again, because of our focus on patient and member experiences, we think a lot about how patients in these different geographies might be different. And again, we're getting people to do lifestyle change. And so what people eat in kind of in the southeastern part of the US, or just in the south of the US, is very different than the north, is very different than the east versus the west, et cetera. And one of the things I'm very proud of is, because of our experience and our approach, we are able to really personalize at scale. And so we did some work with the Area Deprivation Index, which is a validated data set that the University of Wisconsin publishes, and it takes into account a variety of factors for any zip code, including access to care, access to food, education levels, literacy levels, et cetera, et cetera. And we looked at our patient outcomes across all the different basically quintiles of ADI. And I'm very proud to share that no matter what zip code you live in America, Virta has shown that we deliver similar results. And that is very, very unique for a healthcare provider, because often in areas that you would think that in areas that are food deserts or in areas that have lack access to care or have low health literacy, we couldn't deliver the same results. But this is the power of our highly personalized approach. It's the power of the kind of AI systems that we've built that enable us to personalize in the moment at scale. And so we have done a lot of thinking on how to alter our treatment for different regions and different ethnicities and different people, and that has enabled us to deliver great care in all those areas. I will take a note, make a note, because you did ask about international. The other thing that we've learned is the healthcare system in the U.S. is incredibly unique. We, our underlying science is the same no matter where you live. If you do what Virta proposes and has people do, whether you live in the US or you live in India, which I've worked in India before, I've worked in China before, etc., you will see the same metabolic health outcomes. Again, the science is the same, and it's right, and humans are generally humans. The system, the economic system, is very different. And so we only operate in the US today and have a large market to go after here in the US. Again, our mission is to reverse diabetes and obesity in 1 billion people. So we will need to leave the US at some point. But today we're primarily only in the US.
It's very interesting. So you really take a lot of factors into consideration to deliver this highly personalized care. You're taking not only the person's ethnicity, who they are, what their biomarkers are, but you're also building into the background where they live, what's available to them, cultural aspects as well.
Yeah, that's right. And we have many different interventions that we can help with. Everything from taking a picture of a food and us sharing our app, our AI sharing the carb content and whether it fits with your Virta plan and whatnot, all the way through. We have a community of users, and so again, you can say, hey, I'm in this particular town and going out to eat. What are some Virta friendly options for me? And both of our community of users can answer that. Our AI tools can answer that. You could just search in the app if you're struggling with something in particular. Hey, I'm having this symptom. Your coach or clinician might be able to respond to that, or will respond to that if you ask. You can also just search in the app, because we have a tremendous amount of educational content that we help our members with. And so, yeah, we have found one of the things that we've invested in since really day one are these systems and structures that then we can build AI tools on top of and machine learning models on top of to be able to personalize interventions at scale. And so that is a big piece of why we're able to, that's the 1% better that I shared a little bit earlier. Every member that joins Virta benefits from the hundreds of thousands of members that we've already served, and in some way makes the experience better for the next million that we will serve.
Very interesting. I love that, taking a picture of a food and then really getting the nutritional information that you need to make your decision. That's pretty awesome.
Yeah, it's a great feature, and actually one it's one of the ones that I actually pull out my phone and show people, because it's one of the ways that we are in the moment with our members and our patients and helping them make a good decision.
Absolutely. I can see that being used frequently.
Yeah.
So what advice would you give to someone trying to bring this sort of new innovation into a very slow moving, highly regulated, I won't say dysfunctional, but skewed to a certain viewpoint healthcare industry?
Alka, you said a lot of the key things. Slow moving, highly regulated. I think one other thing that I have brought up that I'll reinforce here is that economic model is unique and different in the US. The easiest way to understand that is that in general in the US, the person that pays for healthcare, or the group or the entity that pays for healthcare, is not the person that experiences healthcare. A patient is having their insurance company or employer or the government pay. And so I've likened it to cars before. I grew up in Michigan and therefore, think of cars a lot. I go buy a car, I'm looking for the right combination of, features to go buy that car. And so if someone comes up with a better feature set and charges more, I'd be interested in that. In healthcare, that's just not how it works. The economic model isn't like that. As a patient, you're actually at times unaware of what the payment is and where it goes. And so I always tell people in healthcare, you have to be, many people get into healthcare thinking, oh, we're going to provide better care. And because by providing better care, better quality care, better service care, et cetera, you create value, right? It's better than the system. And again, to go back to the car example, if you provide better value, you should be able to price to it. And healthcare doesn't always work that way. You can't always price to better value. And so if you take more resources, i.e. if your cost is higher to provide better value, you just have to make sure you have the right economic model. And so many times, the first thing I kind of coach entrepreneurs in the space on is try to really think about the economic model and talk to all the stakeholders, talk to the payers, talk to the providers, talk to the patients, make sure that what you're delivering and who you're delivering it to is both interesting to who you're delivering it to and interesting to who will pay for it. And once you're kind of over that hurdle, I think then, to your point, there is a lot of regulatory regulatory work to be done, and to make sure that you can surpass that, you can overcome that, and that honestly requires working with smart and experienced folks like yourself who can educate people on that regulatory work and make sure that their systems in place for that. And then the third thing, to go back to the thing that you started the question with, is it's slow moving. I mean, we've been around for a decade, and it has definitely been like a snowball rolling down a hill. At the beginning, we spent a lot of time, pushing to get through the friction and to, try to figure out the economic model, figure out the regulatory risk, figure out how we can deliver care at scale. And now we're at a good clip. But we joke it's been a decade to overnight success. It's been a decade to changing a tremendous number of lives and being able to do so at a rapidly increasing pace. And so it is slow moving. And so really figure out what the model is and then chip away at it and make it work. The last thing I'll say is that it's incredibly important that we have entrepreneurs and people get into this space. The space is ripe for disruption, and we need to disrupt it in order to be able to have healthier people in America for the next generation. And so while it's hard, it's a lot harder than many other spaces, I would say. It's important. And so hopefully this is helpful to people listening.
Pretty incredible. So what predictions do you have for the future of work in your industry, say in the next 1 to 3 years? Obviously, AI is a big part of it and growing and changing very quickly.
Yes, AI is a big piece, and every industry is looking at the impact of AI, and again, more specifically, recently, of course, generative AI, but as I stated a little bit earlier, we kind of have been using AI at Virta for the last decade. We had machine learning models that helped us predict a patient's likeliness to adhere to our lifestyle changes and drove interventions based on that. Looking forward, I think that one thing that we say internally that I think is true is AI does not replace humans. AI does replace humans that don't leverage AI. And so we have a broad effort to make sure that as a company, as a broader team, we're leveraging AI. Again, we've always done so in our product and product development approach. But because of generative AI is a lot more applicable is a lot more usable. I guess it's always been applicable, but a lot more usable in marketing, in finance, in areas where traditionally we wouldn't think of an AI first solution. And so my prediction for the next 1 to 3 years as they relate to healthcare is that we will continue to see personalization driven by generative AI, which is a good thing, especially because we can solve so many of our healthcare issues by helping people make lifestyle change. And so, again, I think Virta is at the forefront of that, but I suspect we'll see more and more ability to personalize lifestyle change for people. We'll also see ability to personalize interventions outside of lifestyle change. And so personalizing medication regimens and personalizing how doctors are able to interact with patients, I think is some of what we'll see. Outside of that, I think that we should hopefully be able to do that more efficiently. This is more in the 3 to 5 year time horizon, but applying AI tools, well versed, making sure they're trained on being unbiased, but applying AI tools to parts of the healthcare system that today are incredibly manual by design is an area that I think there's a lot of opportunity. But there's also a lot of work that needs to be done. It's not easy, but I think it's highly valuable and will allow us to take certain costs out of the system that will enable us to deliver better care for more people. As people generally know, a lot of the dollars in healthcare don't actually go to care delivery, and I think AI is a tool to reduce that. To reduce those dollars that don't go to care delivery. And then the last thing I'll say is I truly believe that, especially in healthcare, the value of AI is to allow humans to do more human things. We, again, have doctors, nurses, health coaches on staff, providers, more broadly NPs, et cetera. And we believe that we will continue to need them moving forward because we drive lifestyle change takes empathy, it takes creativity, it takes emotional accountability, and it takes complex clinical problem solving. And those 4 things we believe are best delivered by humans. And all the other things I think can be delivered by AI in some way. And so hopefully, empathy is a great example. That's a human skill, and humans usually get joy and fulfillment out of delivering it. So hopefully humans can be doing more human things that drives more just work fulfillment, life fulfillment, because you're helping someone else, and AI can be doing more AI things.
I like that. That makes a lot of sense. Humans doing more human things. Well, thank you, Amit, for spending some time with me and sharing your insights. I thought this was really incredible information. Virta is really on the cutting edge of healthcare.
Well, thank you so much, Alka. I really appreciated it. If people want to connect with me on LinkedIn, they're welcome to, and they're also welcome to send me a note at amit@virtahealth.com. And I'm really grateful for the opportunity to share a little bit more about Virta.
Oh, we're so pleased to have had you. Thank you again. Thank you, listeners, for tuning in to this session of the Think Factory's Workplace podcast. This is Alka Bahal signing off until next time.